The Great Start interviews is currently under process. Most first-year nursing students are ecstatic about this event and hope to be selected, and I am a part of it. My name is Phan. I'm a nursing student at the University of Technology, Sydney. This is my final year of Bachelor of Nursing. After this stage, the theory and practice I have learned from university together with the experience I have enhanced throughout the placement in different works, but it is unpleasant to witness the new class suffer on the job. The emotional distress in new nurses is the most concerning for me. I have found some information and ideas related to this issue through my research and my experience. I'm also aware that nurses are responsible for teaching students, so I would like to share with you and practice my teaching skill. It would be great to hear the feedback. In this presentation, I will talk about the background of the issue. Then I will discuss the factors that lead to the issues occurring and the impact after the issue have occurred. In addition, the strategy to prevent or eliminate these issues occurring will be highlighted in the conclusion at the end. I come to nursing because I inspired from the nurse who has assisted me during hospitalization. Currently, I work as an assistant in nursing at a local hospital. The knowledge and skill that I have learned from university and placement have built up my confidence. I enjoy every step I work. Things went smooth and patient safe and satisfying. Emotional well-being is an integral part to support general health and help the nurse staying longer in this profession. Nursing profession is a demanding job. The new nurses likely become anxious and depressed when facing patient death, trauma, illness, and stress. Emotional distress prolonged, the nurses suffer on their job and can lead to mental illness, sleeping problem, eating disorder, and impact on their family. Research showed that many healthcare workers' emotional distress lead to patient safety compromise as their ability to provide consistent quality care are declined. Adverse events could happen due to stress, less staff, but patients' demand arise, leads to wrong decision making. Now I will discuss the factor and impact relating to emotional distress. As a new nurse, you're not familiar with the place, equipment, you do not know where things are located. For example, you need to do wound dressing change for your patient prior to physiotherapy session. You're looking for the dressing, but you do not know what does it look like. You feel anxious and embarrassing of slow pace. Shift work is a problem for new nurses. Some of you might never be in shift work before. Your routine changing and you feel fatigued due to lack of sleep, and this affects your workflow. Work overload could lead to burnout. You may be located the same number of patients like other staff. You are struggling every shift. and your task still not completed. Honest and open to raise your concern with team leader that you are new, you need some time to cope with the job, and you need help. Facing patient death and dying is the most stressful in new nurses because of inexperience, and new nurses often spend more time with patients, so they usually affect more than others. Senior nurses are the best source that you can rely on. Last year, I have been in palliative care placement. I have not learned to support the patient and families at that stage. I have no experience with family member who passed away. I was anxious and suffered at that time. I discussed my situation to the team leader, and I got supported from the team. Unfamiliarity with local policy and guidelines could cause the patient to suffer, such as medication errors and patient falling. In my previous placement, a new grad as a student nurse transferred a patient from the bed to the chair, result in patient fell. I noted the new grade is not allowing to supervise the student nurse according to their local policy. There are some strategies that you could use to prevent or eliminate emotional distress. Practice mindfulness prior to the shift. Leave your personal aside and concentrate on your job. The benefit of practicing mindfulness is to help you reduce anxiety, improve mood and energy to work, improve clarity of thought, manage your shift by planning all the tasks need to be done, prioritize tasks, discusses or negotiate with team members to ensure decision making accurately and patient safe. Nurses have a moral and legal right to practice in a safe environment without fear for their own safety. You should seek the support from the nurse educator or the nurse unit manager if you feel unsure. Work overload is another issue, can cause fatigue, stress, and patient at risk of safety. You might request to increase staff, negotiate with other teams to share the patient load, re- review registration policy and guidelines, develop your own scope of practice to provide patient quality care based on the evidence-based practice. Nurses are legally, ethically, and professionally responsible for the patient's safe care. Continuing education to profess knowledge and improve professional skill to maintain capability for practice is lawful for nurses to commit lifelong learning to eligible for registration. For instance, you can learn how to assist patient and family in palliative care online. Hand hygiene knowledge you need to refresh every 5 years. In conclusion, nurses are accountable for the patient's safety during hospitalization. Emotional distress among nurses could place the patient at risk of harm. Your general health decline impacts your personal life. When you are anxious and depressed, you feel fatigue and lack of energy, resulting in clarity of thought inaccurate, and you might make wrong decisions and patient self-compromise. Your practice to guideline and policy, continuing education to improve your professional skill and maintain capability to practice in your registration, promote your mental well-being to provide the patient quality care. When you feel depressed, anxious, and fatigued, seek for the support appropriately, and you have right to work in a safe environment, and do not let yourself suffer it. Thank you.